Follow me during a day of clinical.
All right, we're looking at the yogurt. About how much would you say that she ate out of this cup?
50%.
Good job. What about this plate?
25.
25%. Good job. All right. So we're looking at the cups. All right. It looks like she drank 100% out of both cups. One cup hold 8 ounces. It's 30 milliliters in 1 ounce, and she has 8 ounces in this cup. How much is that? How many milliliters? How many milliliters? Yep. And 240. So she had, if 8 ounces is equivalent to 240, so this cup she had 240. What is,
Cup she had 240.
so what is her total liquid intake? 480. Good job. We just walked up on, what is this called?
AED.
And it is what?
Emergency.
So when are we using this?
Oh, we don't use it, do it?
You can use it.
Okay, okay.
So when are we using it?
To
Shock the patient. So what's happening if you happen to
They have
shock
a
the
heart
patient?
attack.
They possibly had a heart attack or
And heart stop.
exactly, the heart has stopped. All right, and so what is the first thing? This is a test question. When you have an AED, what's the first thing you need to do? Is power it on. Once you power it on, it will tell you everything that you need to do. There are pads that are inside of the AED, and instructions on how you will place the pads are actually on the pads. This is something that a CNA, a nurse, a housekeeper, anyone can use the AED. Okay? If your patient was to suddenly collapse and become unresponsive and they do not have a pulse, you're gonna call for help, number one, because we need to do what? CPR, which is called cardiopulmonary resuscitation. While we're preparing to do CPR, this is what you're gonna ask for. Hey, someone go and get the AED, okay? And then you're gonna go ahead on and start your CPR. And when the person comes with the AED, they're gonna place the pads on the patient. So if you know they're trying to put the pad on the right upper chest and the other one goes on the left lateral side, when they're getting up there to the right chest, you want to kind of like move over, make way for them to place the pads, the AED. But basically, you guys are right. This is the external defibrillator, and we use this in an emergency when a person's heart is stopped and we are doing CPR. You got it?
Yes,
What's the first thing you do?
Stop turning on.
Okay, and if your patient is in some water, right, would you shock them?
No.
What would you do?
Gotta make sure they're dry.
Exactly, you gotta pull them out of that water source, and then you're going to place the pads. Now, what if the patient had a hairy chest? What would you?
Shave the hair out their chest.
Yes, you're gonna shave the hair off their chest, or you can.
Use the sticker and stick
What
it
did you say?
Are you gonna have time to do all that?
Good question.
You're supposed to use the sticker.
That's right. So you would take the pads and you would place the pad on the hairy chest and rip it off, and that will provide a place for you to place the pads. Well, if they're unresponsive, they're not gonna feel it. Patients want to take a swim, they're able to do so here. They have noticed the lift over here. For those who need assistance getting into the pool, they have a lift to help them get inside the pool and outside of the pool. This is a heated pool. All right, so this is the perks that come along with the residents that are living in the independent living, right? So we didn't see pools in the long-term care part of this building. All right. All right. Let's go this way.
Yeah, good plan.
It's like a mystery.
Okay, thank you. It's lunchtime. Lunchtime. She over there getting it in. All right, look at here. What do we have over here? What is this? All right, what is that used for? This a review.
For shop,
Bring you back
when you have a CPR and you need to.
Ma'am. Ma'am, what does AED stand for?
Emergency defibrillator.
Lord, help us, God. What is this? What does the ombudsman do? We just learned about this.
To help the patients
Settle what?
disputes.
That's right, settle disputes. But look at some of the other things that he do. He enforces the resident right, quality of care, admissions, Medicare, Medicaid.
education, transfer, discharges.
Thank you. And what's his name then?
Zeke. Hold on. Zev.
Samuel.
So the
Mr. Samuels.
ombudsman has to be posted throughout the facility. All right. Good job.
Did you just fart?
I had my fingers. Did I take my test?